If you are finding you're getting some clicking, popping, snapping in your hips, then there could be something called snapping hip syndrome. Now, snapping hip syndrome is a very common thing. It tends to happen when you are lying down and you're lifting your legs up and down. And every time you bring your legs down, such as in an exercise like a leg raises, every time you bring your leg down, you get a kind of a clunk. Now, generally speaking, it doesn't hurt, but some people do worry about it. They think it could be arthritis. Some people are wondering whether there's something wrong with their hips. So in today's video, I'm going to explain everything about snapping hip syndrome and what you can do about it. The first thing we need to really understand is what is it? And to do that, we're going to look at a model of a hip. We're looking at the pelvis from the front. So this is your pelvic bone. This is the right bone. This is the right femur. So you're looking at it from the front right now. This muscle that you see here is commonly known as the hip flexor. It's called the iliopsoas. And actually there's two muscles. One of the muscles has been cut away. This would attach up onto the lower back, onto the spine. Now, every time you are moving your leg up and down, what will tend to happen is you get a clunk. As that leg comes down, it goes clunk, and then you go again, it goes clunk, and it will keep doing it. And as you're doing it, generally speaking, it won't cause you any pain. Now, there's three types of snapping hip syndrome. There's intra-articular, which refers to clicking within the actual hip joint. So this could be something like a labral tear. Now, for the purposes of this video, we're not going to cover that. Then you have internal, which is related mainly to the muscles of the hip flexors, so the iliopsoas muscle. Now, what would happen here is as the muscle is crossing over this joint line and attaching onto the bone of onto this part of the bone of the femur, as it's contracting and relaxing, or lengthening and shortening, as it flicks over this part here, what will happen, the tension will flick it. And that's every time you move it, you will feel that clunk. And that clunk is the muscle just repositioning itself based on the tension. And then the third type of snapping hip syndrome is called external. And that would usually be around the IT band, the iliotibial band, and it usually happens around this part of your femur. So this is the greater trochanter. Underneath here, or above this, is a bursa that helps with the friction-free movement between the IT band and the bone. Sometimes that can cause clicking as well. We'll briefly touch on that. So we're going to do some exercises and stretches for the internal and some for the external as well. Now, one thing I do want to add is that you can also get clicking elsewhere. So clicking may not specifically just be this snapping hip syndrome. So when you're moving your legs, you might be experiencing clicking, and it could probably be coming from one of those three causes that I mentioned just a minute ago. But it's also worth mentioning that it could also be your sacroiliac joint. So every time you are, say, moving your legs and the tension through the muscles is pulling on your pelvic bone, that could be causing some shift between the ilium and the sacrum. So that could be causing some kind of clicking. Now, the movement that you're seeing here is highly exaggerated. You wouldn't normally get that much movement, but you get the idea. Now, the second place that could be causing some clicking is also within your lumbar spine. So as you are, again, doing those movements with your thighs, as you're doing those movements with your abs, with your hips, it could be that the psoas major muscle that's attached to the lumbar spine is actually pulling on the lumbar spine or the lumbar vertebra, and that could be causing some instability and some clicking within the vertebra. Now, generally speaking, with both internal and external snapping hip syndrome, in my opinion, they are predisposed by either tightness within the area or within certain muscles, or weakness. And what happens is that tightness, as you're going through a certain range, that tightness is causing additional pull, or more pull than the body can handle, and that is pulling things into different positions, and that's what's causing the snap. It could be also weakness, and that weakness is reducing the body's ability to create stability. So by both focusing on flexibility and strength, we can usually overcome this snapping sensation. Now, when it comes to stretches, one of the first places I would start is what I call the 90-90 stretch. What you need to do is get yourself down onto the floor, drop one leg in front of you, Now, you want to make sure that your knee is at 90 degrees. So I'm going to bring my foot further out. So my shin bone and my thigh bone are 90 degrees. Then with the other leg, take that behind you. So now what you're looking at is your thighs. Are your thighs 90 degrees to each other? Once you've got that, then put your knee at 90 degrees. So this is 90, 90. What you want to try and do is then bring your buttock, so the one that's at the back, you want to try and push this down to the floor. Now, as you can see, I don't go that far, so I'm quite tight in my hips. You may go further if you're quite flexible. If you're not, then you might find that this is quite challenging. So what you're trying to do is push your hip down to the floor, keeping your knee, your front knee down. Now you can hold this for about 30 seconds or a minute. Once you've done that, if you want to and you want to increase the intensity of this stretch, what you can then do is try and lift your back knee up and out as far as it will go, and then drop that down. And as you're doing this, you want to try and feel where it's tight through the hip, and you want to try and work into that tightness. So you don't want to try and avoid it by moving yourself out the way so it makes it easy. You want to actively try and get into that and push through that, and then up and down. I would do this about 10 times and then shift to the other side. So again, you've got 90 degrees at the front and 90 degrees at the back. If you find that this causes pressure in your knee, most likely going to be the back knee, you could try and bend that back knee a bit more. So it takes that pressure or that strain away from the knee. But otherwise, if it's fine and your knee is okay, then stick to that. Again, push the bum cheek down, hold 30 to 60 seconds. Once you've done that, if you want, you can then open up that hip by lifting the knee up and down. And again, 10 times on this side as well. So this is trying to unlock the hip joint. This is working on the ligaments around the hip joint and some of the rotators through the hips as well. The next stretch I'd go into would be specifically for the psoas or for the hip flexor. What you want to do is get yourself into a kneeling position and make sure there's padded floor, or if there isn't padding, then put a rolled up towel or something under your knee just so it saves hurting your knee. From here, lunge nice and far, and really important that you pull your tummy in and tuck your tailbone under, so you're drawing up the front and tucking your tailbone under. Then once you've got that and you've got your abs nice and tight, don't let your pelvis roll. Then you can push your hips forwards. You should instantly feel a stretch through either the front of your thigh or through the hip. Some people like to lift up their arms, and again, just make sure you're not arching in the lower back too much, and breathe. So from the side, what you're trying to do is avoid sticking your bum out and doing this. What you want to do is tuck your tailbone under and then push your hips forward from there. You'll find that you can't go as far forward if you have good alignment in your pelvis. So that's your hip flexor stretch. I would do that 30 seconds, build that up to a minute over time. Do that on both sides. If you feel any pain, then just don't do it. If you can't kneel, I'm going to show you an alternative right now. So if you find that you can't do hip flexor stretches on the floor, what you can do is come onto the bed, shuffle right up to the edge so that your bum is basically just on the edge of the bed. Lie down and lift one knee. So if you want to stretch your right side, your right hip flexor, then pull your left knee up towards your chest. So what this does is it prevents your pelvis from rolling. It prevents your back from arching. So it pulls the pelvis and puts that nicely into wherever you're lying on. Keep your legs straight, because if you bend your knee, you're going to be stretching your quads more. So keep your legs straight and then let that leg just hang down. If you have someone available, what you can do is just get them to put some pressure down on your thigh just to intensify that stretch. Personally, for me, I don't feel a stretch. I would need someone pressing down, not because I'm flexible, just because the weight is not enough. So work out which one works best for you. Again, do that for about 30 seconds, build that up to a minute. Now, so far, the stretches that we've done have been mainly for that internal snapping hip syndrome. So basically, we've covered the hip flexors, the iliopsoas. Touching now onto the external causes, the IT band, what we're going to do is just a couple of stretches for the tensor fascia lata, which is the muscle that attaches to the front of the IT band, and then a stretch for the glute maximus, which attaches to the back. For more information about IT band, you can check out my video just here. That'll go into more detail with these stretches, so check that one out as well. But what you're going to do, similar to the lunge stretch that we did earlier, get yourself onto a pad, something soft so your knees are not going to hurt. Find something that you can hold on to. Either side of you is fine. And with this front foot, rather than it being directly in front of you, what you're going to do is shift that across to the opposite side. So it's going across your body. From there, you're keeping your body pointing forwards and shifting your hips across. So what you're doing is you're putting some adduction through this hip that you're trying to stretch. So you've gone across the body with your hips and then lunge yourself forward. Now this could stretch anywhere from the top of your hip all the way down the thigh to the outside of your knee. So if you feel any stretching along this route here, that's probably fairly normal, as long as it's not causing you any pain. So shift across and then lunge forwards. Again, keeping your pelvis nice and tucked under, so tailbone tucked under, abs tight. Hold for 30 seconds, and over time, build that up to 1 minute. Once you've done that, then obviously you can do the other side as well. Shift across, push your hips over, and then push forwards and repeat. Now to stretch the gluteus maximus, you can do that from a seated position on the floor, or you can do that from a chair. It's no problem, it doesn't matter which one you do, as long as you're comfortable doing it. So from a seated position on the floor, what you can do is bring one foot over the other leg to the outside of your other leg, grab your knee and pull that in towards your opposite shoulder. So my right knee is going over towards my left shoulder. You should feel a bit of a stretch through the back of your buttocks. If you don't feel a stretch, then it may be just that you don't need that stretch. So don't do it, or if it's causing you pain or any discomfort, then just stop. But I would do 30 seconds and build that up to 1 minute. To stretch your glute maximus, and doing this from a chair, it's pretty much the same thing. Bring one foot up onto the other knee, grab your knee and lift that up and over towards the opposite shoulder. Personally, I actually find that this stretch is more effective for me sitting down than it is on the floor. But choose which one works for you. If you feel pain, then don't do it. But if it feels good, then keep doing it. Start with 30 seconds and build that up to 1 minute. And of course, you can do both sides. Now, part of your recovery from this snapping hip syndrome is going to be strengthening, which is just as important as the stretching. So the first exercise we're going to do is called a dying bug. Don't ask me where that's come from. You're going to lie down on your back and you can have your hands down by your sides or up here if you want to decrease your stability. Or I'd recommend starting just down by your sides. Press your spine into the ground. So you take out any lordosis, any gap from the floor. You press your back into the floor. Now with one leg only, because we're starting from the basics, one leg only, you can lift that leg up, have your knee at 90 degrees, and then slowly take this heel down to the floor, but you're keeping your back pressed into the floor. Touch the floor and come up. There's a lot to think about with this exercise, so take it slow. Although the leg is the thing that's moving, it's actually the back that you're trying to be thinking about. So as you're bringing that leg down, keep thinking about pressing your lower back into the floor. Take your leg down slow, touch the floor, and then up. If you feel any clicking in the hip, try adjusting the rotation through your hip, or maybe just don't go down so far. So if you get a click there, then you stop there. And then you come back up, come down, and you stop there. And over time, as you get stronger, then you can go further and further down. Now, once that becomes easy for you, you can then do it with a straight leg. So the same principle applies, back pressed into the floor, nice and slow on the way down, touch the floor with your heel, and then come back up. Do this really slowly. If you rush it, then you're not thinking about the movement, you're not thinking about your core muscles, you're not thinking about your pelvis and your lower back. So everything should be still apart from the leg that's moving. What you don't want to see is your spine coming up like this, because then you will get clicking in the hip. So I would do 10 repetitions. You could do one leg at a time. So you do 10 on the left, then 10 on the right. As you get better and better, then you can add in a second set and a third set. Once you feel like you are quite strong and quite capable of doing this, then you can go into doing it with 2 legs. So the same principles apply. You're still trying to press your back into the floor and then keep it nice and slow, and then obviously with straight legs as well. So that is snapping hip. Now, in my opinion, snapping hip is mainly due to inflexibility or a lack of strength and stability. Most people, or most patients of mine, have overcome snapping hip syndrome. We're talking the internal and external snapping hip. We're not talking about the actual joint dysfunction. Most of my patients have overcome this through either stretching or strengthening, or both. Now, if you have snapping hip syndrome, then spend a bit of time, first of all, on improving your flexibility. Then, once you've done that for a period of time, go into some strength training. Both of those are important components. You can't just do flexibility and you can't just do strengthening. You have to do both. Now, of course, it is worth getting your hips checked out. So it's worth going to see a doctor, getting an x-ray, just making sure you've got actually no joint dysfunction or no sort of wear and tear in the joint. Maybe even an MRI just to rule out the possibility of labral tears. Once you've been given the all clear from that and you've had a proper test, proper diagnosis, and it is snapping hip syndrome and it is internal or external, then go through this process. To overcome this fully could potentially take months, but most of the time the patients that I've worked with have overcome this. So all it needs is consistency and patience. If you feel any pain while you're doing any of these exercises or stretches, then obviously stop, give it a few days, and then carry on after that. What I want you to do after watching this video is let me know which exercises or which stretches that you've tried and which ones have helped you. If you found them particularly useful, let me know. Or if there's anything else that you want me to do regarding hip or any other part of your body, then also please put that in the comments section below. Until the next video, take care and I will see you soon.